with Martin here from NHS England. He is the director of the Coalition for Collaboration. Is that right?
Collaborative care.
Yeah, the collaborative care, absolutely. And I'd love to give him longer, but I'll just give him a little 10-minute slot to introduce what he's talking about, and over to you, Martin.
Right. First thing to say is I'm not from NHS England.
Sorry. I got that twice now, haven't I?
Although you might be tempted to believe I am, as I'm employed by them on a secondary basis. I sit in their offices, etc., etc. But the Coalition for Collaborative Care is an independent alliance of partners organisations, which just happens to sit in NHS England. I call it half in, half out. So I'm just going to do 10 minutes about what we are and what we're for and how we're trying to do it, and then try and tempt you to connect to us, if that's all right. What we're for is to help you do what you're doing. I'm really so pleased to be here today. I just found this morning incredibly energising and motivating, and made me feel like actually perhaps what I'm involved in here might be worth doing. Isn't this wonderful? You can just do that and that happens. So what we're for a better deal for people with long-term health conditions. We've come together from two main routes. One of them was people working in primary care, mainly, who were increasingly frustrated that they weren't able to help people with long-term health conditions get what they really needed. People with long-term health conditions, 50% of people who come in GP surgeries, people with long-term health conditions, often multiple long-term conditions. Very often the kinds of things that people want and need are not available from the doctor, as we've been talking about this morning. An example of that, I sat in a doctor's surgery who was doing personal care and support planning as part of what they do. An elderly lady with multiple long-term conditions. There were various things that the doctor might be able to help with in terms of medication and so on, but the lady really needed to cut down on the smoking if she was going to improve her health. She was living in dreadful housing conditions. There's no way in the stress situation she was going to do smoking cessation and stick to it. She really needed to live somewhere else. And the relationship between the GP practice and the local registered social landlord made that happen. So they could then start to have a conversation about what is it you want from your life and how do you make that work, and how, to what extent is reducing your smoking part of that. The other main route is what you lot are doing, I think, what's variously been called more than medicine or people-powered health. So in particular, a programme of work led by an organisation called Nesta, who have worked with a number of places around the country to try essentially the things that you've been describing this morning, and to look at how to make them work, the effect that they have, even how much money they can save, etc. And these two things are a really natural fit, actually. So if you're somebody with long-term health condition like I am, who comes into GP surgery, you want to have a conversation rather than a short consultation. You want to work out what's important to you, and you want to work out in partnership with health staff and others about how to make that work and happen realistically. But you also might want stuff that, as I say, the doctor can't give you, and you need to be connected to that in a useful way. So these things come together quite sensibly, conceptually. People have been thinking about these and working on them for ages, and we're very frustrated that even though great ideas and evidence for it have been emerging for quite some time now, it's not happening enough. It's not really embedded in how health and care and other public services work. Is there anything we can do to drive that forward? And about 15 organisations came together who've been thinking and working on this for some time, and they eventually formed the Coalition for Collaborative Care. It launched formally at the end of last year. That happened as a result of this group of people have been talking to each other for ages. They really needed a little team of people to help organise it and coordinate it. So my team got recruited last autumn. We're a tiny little team, there's 6 of us. We don't all work full time. We've got a small budget that comes from NHS England that pays for our team. Apart from staff resources, 80% of the budget we have goes on supporting co-production. We have 28 people currently, people with lived experience, who are people with long-term health conditions or family members who form our co-production group. And essentially, we're talking about, it's terrible, isn't it? There's always the 3 C's or the 5 P's or the 7 something, isn't it? We've got 3 C's. which are conversation, communities, and co-production. Yeah, so there's something about better conversations between people and health and other workers to in partnership work out what's important to you and how you can make that happen. Most of that stuff is going to happen as a result of strong communities, and if it doesn't happen in co-production, it's not worth doing. Our view, as I said before, is a systematic change is needed. One of the problems often is, and I'm sure you'll find, is you're able to get a little bit of something going, where we're needing something really systematic going. We need health and care professionals who are committed to partnership working. We need engaged, informed people so that they're up for that and able to be part of it. We need organisational supporting processes to make it possible. We need commissioning to be done differently, to commission different things, as we talked about earlier on. Oops, sorry. One of the problems is if you touch it, it happens.
The back arrow.
So just, because I've only got 10 minutes, just really briefly, in terms of how we're trying to go about this, we've got 47 organisations currently, because we've grown our partnership over the past 6 months or so. They include most of the rural colleges and professional bodies like RCGP and RCN and so on. A lot of the significant long-term conditions charities like British Heart Foundation, Diabetes UK, Alzheimer's, Macmillan, etc. Organisations that are focused on innovation and evidence like Nesta and the Health Foundation. System leading bodies like NHS England and NHSIQ and Public Health England. And organisations that know about person-centred and community stuff. That have been working on that for years and can share that expertise with other partners. And our model is that it isn't going to be what my little team of 6 do that changes the world. It's going to be what everybody does that changes the world. So our job is to try and, you heard of the term patient activation a lot? Yeah, so we're talking about partner activation. You're all talking about activating somebody else. It's time you activated yourself. What are all these partners going to do with their significant resources and their connections and their clout and the political capital to make this change happen? And to what extent do they need to do that together and in synergy to have greater clout and make a bigger difference? So we have a depth and breadth approach. Before I say that, I'll say, in a nutshell, I would argue that what we're doing is supporting the doers and creating the conditions. Yeah? So supporting the doers is showing what's possible at a significant level. Yeah? And creating the conditions is removing some of the barriers that are in the way of people who want to do this stuff to be able to do it, and creating more enablers so they're more likely to be able to do it. Yeah? So the depth stuff includes working with and influencing places and systems that are kind of setting the direction for the rest of the system. So we've got the 5-year forward view. We've got chapter 2 of the 5-year forward view. Everybody's read that, I'm sure. But essentially it talks about, I can't remember the exact phrase, but it's something about harnessing the renewable energy of people and communities. Yeah, there's been a lot of conversation today about the system bust. It isn't going to be able to go forward as it is now. It's going to fall over quite quickly. Jeremy Hughes, what's he called? Jeremy Hughes is the chief exec of the Alzheimer's Society. Jeremy Hunt yesterday said it's the worst financial crisis in the NHS history. You can edit that bit out, can you? I know who the Secretary of State is. I know what his name is. And there's a Simon somebody around as well. But the question is, how is that going to happen in practice? The stuff that you're doing, is it happening in practice? But how does that get happening everywhere at a big scale for millions and millions of people? And how does that 100 billion quid that we were talking about, 180 billion somebody mentioned, get used differently over time? So we are working with and trying to influence things like what I call the 5-year forward view demonstrator programs. Yeah? So these things like the New Care Models Vanguards and the Integrated Commissioning Program are supposed to be kind of showing what you can do, aren't they, over the next few years? So there's a story that needs to be told about them in a couple of years, which is you can get quite different results. You can have more efficient systems that get better outcomes for people. And what we need to show is that key ingredient to that is the stuff that you're talking about. Key ingredient to that is person-centred care, community-focused and community-led initiatives. So the story that gets told needs to be not just that, yes, if you reconfigure a system, you can get a different result, but you have to have a different model, and you have to have different stuff happening inside that model. So we are working with, influencing those places in all sorts of different ways to embed person-centred, community-focused activity in what they do. we haven't got any money, as I say, but we've got loads of people who got clout and have got resources of various kinds. Another thing, apart from the depth stuff, the breadth stuff, and I think today is really interesting for me from that point of view. We want to kind of get the back of all those people like you who are trying to do this. Yeah. So around the country, there are thousands and thousands of people who are ploughing away at this, wanting to do it. And sometimes they need to be connected to somebody else who knows something. They need to be connected to some resource or some method or some approach that they'll find useful. And so we are rapidly mapping networks and making connections to organisations and groups. We've got a membership base that's got about 1,700 organisations so far. We're looking to set up with partners opportunities like this all over the place at a regional level, kicking off later on in the autumn. Our website's going to have lots of resources and materials on it, kicking off later on this month, etc., etc. So depth and breadth, get that? And then creating the conditions, 3 areas there: workforce development, evidence and knowledge, and system levers. So what kind of workforce does there need to be that can deliver this stuff? How do you bring that about? What kind of training and development do they need? What is the workforce of the future? What can we do short, medium and long term about that? Can we help the RCGP to develop a different curriculum? Who's the GP in the room?
There's 2 of us.
Yeah. So that you get more people like you doing the job, and actually, there actually are a lot of people like you, aren't there? I know you're connecting to them on social media and others. My experience over this past year is loads of GPs are up for this. So that's short-term stuff. Longer-term stuff. How do we get Health Education England and all the stuff that they commission different stuff over the next 5-year plan, etc. So we are working with them to do that. Providing and using powerful evidence. We had a really interesting discussion earlier on, didn't we, about what evidence is and how you get it used and what are the best approaches to it. If I'd have come in on the end of that question about patient story, I would have said yes, of course, but my strategy is a Machiavellian one. You ask the question, who is it you're trying to influence, what influences them, and you do that. Yeah. And so you have to map people. What influences them, who influences them, you have to do that. We got I'm not sure I should mention realising the value, as you came only in the top 5. That's fantastic you came in the top 5, isn't it? What were there, 80 odd organisations that went for it? Yeah, brilliant. So we've got a partnership with them whereby we're helping them to do their thing, which is look at what works, how you get it to work, and then get it working. But over that period of 12 months or so, they're developing tools and approaches and methodologies, and the key thing for us to do is to get that out there so that people are able to use it. But it's not just evidence, it's knowledge as well. And then system levers. One of the things that we spend time doing is going to places and saying, what's in the way then? You know, it's QOF, or it's commissioning requirements, or it's financial flows, or it's metrics, or and it's probably all of those things, I think. So, question: what are those system levers? To what extent are they pullable at national level? Because let's not kid ourselves, and I think today's demonstration of it, that most stuff happens and changes at a local level. But there are some things actually that if you could get them done differently might be really helpful. And we're trying to work out with people what those things are, and then we're trying to work out what the opportunities to pull them are. So one of the reasons that I'm happy to be based at NHS England is that a bunch of people around NHS England have their hands on those levers. They don't always know that they have, and they don't always know what they are, but they do. And it's much easier to pull those levers if you have a relationship with people. We talked about relationships a lot today, haven't we? So half in, half out, near finish. So those 3 things, you'll see if you connect to us, and that's easy to do as a member. You don't have to do anything, you get stuff, you can do stuff. You'll see over this next month or so materials starting to appear, so we're about to put out a paper on system levers. We think this is what they are, what do you think? What do you think about opportunities to pull them? What shall we do? Etc. etc. And this is us. If you go there, you'll find an opportunity to become a member. Hands up, anybody in the room is a member already? Yeah, good. The worst that happens is that you have to get a newsletter once a month, but better stuff than that will happen as well. We had a couple of really good gatherings north and south with people who are up for this from around the country. And now we don't run them as normal conferences. The idea is something more like today, you know, energising, motivating, informing, connecting. That do?
Fantastic.
Thank
Brilliant.
you.
Thank you, Martin. I know Martin does have to get down to London, so I'm going to get allowed a couple of questions before, but it's just really nice to know that actually, whilst we're working really hard at grassroots, there's actually a lot going on at the top level as well. So this is not something that's going to, that we're starting to become more mainstream. It's really nice to hear that. A couple of questions.
So you said top level, and you said you help people. Does that mean you help people like us?
Yeah, it depends what you mean by help. You know, we're in the context where there's 6 of us and no money, but we're getting connections from people all the time saying, do you know anything about such and such, and can you connect us to so-and-so, and do you know anybody who does this? And as I say, we're planning to do something at a regional level. We're coming together with a number of other organisations to try and facilitate some kind of regional networks. One thing we don't want to do is replace networks already or get in the way of networks that already exist, but we want to see whether we can add some value to them and sometimes bring networks together who can support each other to make a difference. So we're happy, when we get, every week we get lots of people contacting us saying, can you help me, this is what I'm doing, and then we work out whether we can or not.
Yeah,
one of your bosses taught me about Twitter 3 or 4 years ago. Maggie Rogan. Yep.
well, so you obviously know that I do work a lot of co-production. I've seen some wonderful things co-produced, like £10 million fulfilling life programs, and dry bars, and events for HSC. But it does, and I'm going to ask you to allay my worries a bit. I'm all for joining this, but it worries me a little bit that it's tied in with the 5-year forward view. Yeah. Because then, some of the people I come into contact with, it's probably some of the people who come into contact with, may start to see it as a box-ticking exercise rather than actually. And I found that the best co-production goes on organically. It's come out of it. Oh, well, there's a problem. What's the solution? Let's get together.
Yeah, totally agree.
Hi Martin, thanks very much for that. Do you feel there is an appetite for co-production in the way that you're talking about? Because even, and I'm the video cameraman, so I will edit it, I'll send it to you. If you give me your email address, you can check that you're happy with it. But actually, that is the real conversation, and we've got to become less fearful of talking about it, as leaders, I'm talking about. But, if we don't do that, then there's a conversation happening on the ground, and there's people in Quarry House and Skipton House who are supposed to be the leaders with their levers, but they don't want to hear this stuff. And actually, they've got to do, because otherwise, there is going to be a major battle on. Yeah,
for me, I'm reasonably optimistic, I think, because our co-production group's been in existence for about 6 or 7 months. I think it's already had quite a significant difference. I think it's going into places and meetings and discussions that there wasn't a voice before. There wasn't anybody with long-term conditions or a family member in those conversations before, and I think some different stuff is emerging from that. We've got 2 members of our co-production group who are on the People and Communities Board of the 5-Year Forward View, and I think that I've seen it, the conversations that are happening there about what's important and how to make it happen are different. This is a long haul, isn't it? It's a massive cultural change that we're talking about at all sorts of levels, and it won't be just obviously what happens in Quarry House or Skipton House that matters. But my experience is that when you get people in a room together, they relate to each other as people, and you can start to make a shift happen.
So as a sort of a challenge, perhaps, can you imagine some of those members moving from the Communities Board to the National Information Board?
Yeah, I can.
Or to the board of NHS England, which is where the actual decision.
I'd be amazed if that doesn't happen in the next 12 months. I would. Because I don't think it will be possible for those groups to say no over this next 12 months.
That's really interesting you should say that, because I was following some stuff on NHS.uk the other day, which the National Information Committee, and it was somebody from the Department of Health, and I was looking through it thinking, oh, this is good that it's happening. And I asked, is there any people with lived experience, patient assistants, whatever you want to call us, there? And there isn't. So we have a bit of banter, and I'm going to have a conversation with that person outside of that, and it'd be really good to know that you're having that conversation too, and everybody else, And I'd just like to say, and that points out the power of Twitter and social media, because I don't have anything to do with any of these things.
I had a really. Did anybody go to Expo, NHS Expo?
Yeah, I watched it on Periscope.
Yeah, okay. So it's a weird thing. I went for the first time this year. It's a weird thing. you know. Some of a lot of our co-production were there, and others, and there was a people's panel. There were people's voices on in all the presentations and all the panel discussions and all the rest of it. And yet it was like a parallel universe, wasn't it, of you know, people's voices there being present, and loads of people doing business as usual in their suits in parallel as well. Yeah. So there's a massive shift to happen there, isn't there? So something's happening, I think, and something more can happen.
That's true, because I remember being involved in one 3 years ago when the NHS England first set up. I had a role to support the CCG lay assessors at that point at NHS England, and I had to beg David Nicholson to invite these CCG lay assessors to come along, because they'd done such a brilliant job. And he invited them, and they were the only citizen representatives in the room. It was awful. So it has come along.
Well, that's quite a difference then over a small review.
Yeah, it's a massive difference. Can I just ask you a question about what have you learned from here? You know, what have we, as a group, given you, and how can we connect? You know, what you're doing to support what's happening here, and how can we support what you're doing?
Yeah. I suppose I've been, I was saying to Ollie, I'm totally energised by being here today. It reminds me why I'm doing what I'm doing. No, I'm working in this kind of weird place. So Ollie called it the top. It's not the top, is it? It's, you know, it's just another place, isn't it, where stuff happens. And I've been doing that for about 15 years, and it's a very strange experience. I think of it as a bit like a sleeper agent, you know? I went into these organisations and I'm a spy, and now I've activated myself, now I've got a bit of influence kind of thing. That's how I see myself. But it's a really, really strange experience in a strange world. But it is occupied by people, you know, and they've got families and you know, some of them support Arsenal and, you know, all sorts of things like that I can connect with them on. You know.
It's worse than I thought.
Actually, I just should remember that Pete Moore, who was quoted this morning, he is a gooner, and he's asked me to remind you that there's a tweet chat on this evening. He's tweeted me to tell everybody.
That's the link.
About Arsenal.
No, it's not about Arsenal, it's about pain.
Self-management pain.
So I think in terms of connecting to us, you know, as I say, we're trying to construct a range of ways in which people can share learning and energise and support each other. I was just saying to Ollie, one really immediate practical thing that I'd find really useful is to all the people who've presented today is to get stuff and share it. So we can immediately do things like, you know, guest blogs, sharing your products. We talked about maybe doing some pieces of film if people want to tell us what they're doing. And we can get that out directly through our channels and through all our partners' channels, etc. You know, so one immediate thing we can do is get it out there. But I think more substantially going forward is the regional element of our work that we're trying to construct. You know, we're trying to construct it with no money, etc. But the idea of at a more local, regional level, identifying networks of people who have got common interests, and they may be of various kinds, I think. So I guess first thing I'd like to do is connect with people outside of here, maybe through yourself, Ollie, who want to share stuff via us. But I'd then like to talk to people more over the next few months about how people might connect into the, particularly the regional level activity we're doing. But also, if people are wanting to get involved in some of that changing the conditions stuff as well, to bring people's insights and experience into that too.
You know what I'd like to see, because I get a lot of invites to do things like this, because I'm on Twitter and you've got a big mouth. And there's a lot of people like me there. And I think those people end up sort of being heard. And I think, in my experience, there's a lot of people, and we've heard some of it today, who are doing way more, who've got some really powerful stories to tell, and they're not getting through. And I think they would be better to be up there.
Yeah, I think that's.
Help you do that.
Yeah, I think that's right too. And so, in thinking about where we go here with co-production, you know, we've got 28 members of our co-production group, and obviously they themselves are connected to loads of other people, and there's all the people that you don't know about doing stuff at a local level. The question is, how do you connect and harness what they've got? So we're still thinking about that. I'm really up for discussion about it.
And I think that's the problem that we have, that there's a lot of gatekeepers. I don't mean on your group, there's a lot of gatekeepers in terms of big voluntary organisations and people who are
Yeah.
enjoying the role.
Yeah, that's
They're
right.
really good. It's not that any of those aren't really good. They're really good, but I think there's something else that we're missing beyond that.
So I can see a filming day at Shipshape.
I really agree.
We've already got,
and
got some films,
we have
some
got
great
some
films.
great stuff,
Yeah.
How do we turn this around?
Yeah. I don't know quite, but let's talk about it. Yeah.
Just
I'm letting this run a bit because I know we've had some questions, we had some time at the end of the day, but actually I think almost I'm going to slightly turn it around. 'Cause we've got some very valuable stuff to come, so we're not going to lose it now, don't worry.
Martin mentioned Quarry House. Those of you that don't know, Quarry House is the northern headquarters of the NHS.
Kind of Starling Gothic, it looks like.
Yeah, I sent one of my patients over to a meeting at Quarry House, and she's never been involved in anything to do with the NHS management or anything like that, and she didn't really know what to expect, and I didn't quite know how to prepare her for it. So what I said to her was, have you watched Lego Movie? Has anyone watched Lego Movie? Okay, so the challenge that we have got is Lego Movie. And Lego Movie, it's a bit of a joke. If you haven't watched it, you must watch it, because you will understand then what the challenge is all about. And in Lego Movie, there's this guy who, everyone's looking for the special one, who that special one is. And Martin, that could be something you could take back to London and see your bosses and everybody else and say, listen guys, there's a movie out there, it's called Lego Movie, and the special ones. And what that's all about, because Lego Movie starts to talk about how we can change it, but there will be someone at the top who's going to be sitting there thinking, feeling very threatened, and all the gatekeepers and all that sort of stuff. But do you know what? The fact that the movie's being produced means the game's up. The leaders now need to realise that you cannot continue like this because the system is completely broken. And we now need to change the way things are so that Quarry House and Skipton House are no longer seen like these, how did you put it, Towers of Babylon or Towers?
Ivory
Towers,
yeah.
Ivory Towers.
Yeah.
Those ivory towers might have got us where we are, but they're not going to be fit for purpose for the 21st century, and that is on camera.
One of my experiences of 10 years of working in the Department of Health also is that there isn't a God figure, you know, there isn't somebody who's omnipotent and omniscient in there really isn't. And power is really dispersed as well. So you've got to think of it's complex, is what I'm saying. You know, you have to think about what are you trying to do, what might be a strategy and set of tactics to move things in that direction. And you have to be ready to be opportunistic and adjust because power is so dispersed, I think. And it isn't really held at the centre, you know. The centre can decide to, you know, do some things or other things, but it's held in all sorts of places, including our hearts, you know.
Yes. Yeah. Well, I think that's a lovely point to round that off, actually. But I've seen the Lego Movie. I've got kids that probably don't see it anyway. I think everyone in this room, everyone in this room is a master builder.